Good Friday afternoon. I'm Dr. Martha Buchanan, Senior Director and Public Health Officer here at the Knox County Health Department. Our moment of gratitude today is dedicated to our testing team and partner agencies who were involved in yesterday's testing at Greater Warner. On an extremely hot day, our team was in full PPE and tested nearly 400 people. We are so grateful for their hard work and the commitment to serving our community. We also want to thank KPD for directing the traffic and keeping everybody who was waiting in line safe. Now a note about our testing at KCHD. With these extremely hot days, we don't want people waiting for long stretches of time in the heat to get tested. Because of that, we are looking for options to house our Monday, Wednesday, Friday testing where those waiting in line can be inside and out of the heat. While we work out the details, we will not be testing at KCHD on Monday. We apologize for that inconvenience. We hope to be able to resume testing on Wednesday, and we'll have more details on the format by next week. We thank you for understanding as we navigate these changes. Now we'll move to the local situation. We have 2,053 confirmed cases of COVID-19 in Knox County. Additionally, we have 86 probable cases. 936 of our cases have recovered, giving us 1,100 active cases. 153 individuals have been hospitalized at some point in their illness. Currently, there are 44 Knox County residents hospitalized. We are thankful that we have no additional deaths due to complications from COVID, keeping our total at 17. Today is our largest single day increase since the pandemic began. We have said many times that this is extremely concerning. As we continue to see cases jump, we have heard anecdotally people questioning the effectiveness of the mask order or mask in general. We want to make a few points regarding this thought. First, the Board of Health's mask order will only help reduce the spread of COVID-19 if everyone buys into it and participates by wearing a mask every time they are in an indoor public space. It requires participation to see results. Sorry about that. Second, it will take time to see the fruit of our labor. As we stated during this week's Board of Health meeting, 4 months of data has shown that any policy change aimed at slowing the rate of COVID-19 hospitalizations takes 3 to 4 weeks to have a detectable effect. It has only been 2 weeks since the order began. Third, due to lab delays we have spoken of previously, the cases that we are reporting today could be results from tests that were done a week or maybe even more time, longer ago than that. Because of that, we are not seeing the test results in real time. That said, we encourage everyone who gets tested to treat their test results as positive until they get their test results back. We know this is difficult, but it is critical in reducing the spread if you quarantine until you know the results of your test. Nobody wants to accidentally spread it to someone else because they chose to, as Dr. Shamia said Wednesday evening, host a dinner party in between getting tested and knowing the results. Nobody wants to be that person and do that, put that others at risk in that way. So we really need you to stay home between getting tested and knowing what your results are. We realize that can be a long time and it's inconvenient, but it's very important that we all do these things to reduce the spread of this disease in our community. In a global pandemic situation that can leave you feeling powerless, wearing a mask is something that you and I can do to make a change that will point us toward the right direction, in the direction that we all want to go. It allows people to keep working, therefore keeping the economy running, while also protecting the people around you. As it is the much sought after middle ground that is typically hard to find. But in this situation, it's as easy as wearing, and I didn't bring my prop, it's as easy as wearing a mask in order to keep our moving forward. And as Dr. Shamia stated, not having to go back, or as the order actually stated. Like we said last week, we are truly all in this together. And the only way we will get out of it is together. Now I'll open it up for questions.
All right, the first question that we have is from WBLT. It's David asks, what is the percentage of new cases that the contact tracers are able to find out the point of infection in Knox County at this point?
As we stated previously, that is a big data pull for us to be able to do. And right now, our staff are really concentrating on getting a hold of people, getting them into isolation or into quarantine so we can reduce the spread. We'll be able to have that information for you later.
Also from David with WBLT, he's got a question on ICU and hospital bed capacity. On the website yesterday, it said East Region hospitals have less than 25% of hospital bed capacity left and less than 10% of ICU beds. What does this mean as cases rise? Has anything been recommended or considered for local medical centers to suspend elective surgeries again?
As we've stated several times, the hospitals are meeting at least weekly, if not more often, to discuss capacity and surge. And actually the numbers look better than they did last week for capacity regarding beds and ICU beds. So they keep a very close eye on that. They're going to be looking at their surge plans as was noted at the Board of Health meeting. So they continue to be in conversation about what they can do to continue to provide regular services, serve the folks who are non-COVID patients and serve the COVID patients. So I trust our hospitals who really collaborate very well together. And for those of you who maybe have lived in other places where that doesn't happen, we are very fortunate that they come together with the goal of really caring for the community and safeguarding their employees and the community as much as possible.
A couple questions here from Vincent with the Sentinel. He says the incubation cycle for COVID-19 is still 14 days, correct?
It is. The average, it's 2 to 14 days, averages around 5 days.
And then he says symptoms typically appear earlier, correct? Typically within a week?
Yeah, 5 to 7 days is when we typically see the first onset of symptoms.
His next question is, how many test results are you receiving 10 days after collection? Please estimate the proportion.
That's not a number I have in my head. We can possibly get that for you. Again, our staff is really, really busy doing their jobs. They're very busy reaching out to cases and reaching out to those direct contacts that need to be in quarantine and having cases get in isolation and getting at-risk people tested. So I'm not sure how challenging it would be to get that specific data, but we'll do our best.
Also from Vincent, if you are receiving a substantial portion of tests after 10 days, that means that you're receiving confirmation of COVID-19 well after an infected person would have completed a typical course of infection, correct?
That is correct. And that's one of the challenges with the lab delays. And also a really important reason why we want everybody to stay home between getting tested and knowing what their test results are. And on that note, one of our challenges with lab delays is that testing is being used in ways it's really not intended to be used. Testing is really to diagnose somebody with COVID right now so that we can get them in isolation and get those at risk around them in quarantine. Testing is being used by businesses and others to screen employees to go back to work, giving them a false sense of security, quite frankly. The recommended strategy for employers is to screen using temperature and symptom check, and then to put all of the 5 core actions in place in that office building or whatever setting it is the business operates in. That's what's going to reduce risk. That's what it's going to keep them safe and free up some testing capacity for folks who need to get tested, who might have symptoms, and decrease our wait times for labs to come back.
Another question from Vincent. Many people are not able to quarantine in advance of a positive test. Employers are asking people to provide a positive test in order to self-isolate. What do you say to people in that circumstance?
I think the employers need to look at their employment guidelines or HR policies, sorry, that's the word I needed, HR policies, and adjust those. We're in a situation where getting a negative test to go back to work is really not a reasonable expectation. Even if somebody's been a case, and then the employer asks them to get a negative test before they come back to work, that person is no longer infectious, but could potentially test positive for COVID for weeks. The virus stays in their system, it's dead, it's not making them sick, it won't make anybody else sick. but it can hang around for weeks, and they do what we call shed virus, and that's going to show up in the as a positive test. So that person's out of work for weeks. After the 10 days of isolation, they're considered no longer infectious. They're safe to go back to work. A negative test is not required.
From Jeff with WATE, can you tell us if the fatalities in the last 2 weeks were in hospitals and nursing homes or at home?
I really honestly don't have that information with me. We can get that to you later.
From Grace with WBIR, we've received a tip regarding Knoxville Catholic High School. We were told they were practicing a player who had tested positive for COVID-19 before the player spent enough time properly quarantining. The tip also said the health department confronted Catholic at practice regarding this situation. Would you all be able to confirm if this is true or give more information regarding the situation?
As we've said many times, we don't give more specific information out about cases. And unless it's publicly necessary, we don't talk about clusters. We don't release information about cases or clusters unless it's publicly necessary.
From Scott with Compass, have any clusters or trends emerged from the cases reported in the past few days?
Honestly, no. What we're seeing is across the community, we're seeing people, infections occurring in employees, at work. We're seeing infections occur in social gatherings. We're seeing infections occur at homes. We're seeing infections that where people maybe got exposed at church. So we're seeing it across the board. What I think people need to take from that is that COVID-19 is very much alive and well in our community and being spread, and it's being spread everywhere. So no matter where you are, you need to follow the 5 core actions. And that is what's going to get us to the next, to be able to not have to go backwards. Right now, I'm going to be talking about moving forward. We need this to flatten out. We've talked before about flattening the curve. We need to flatten the curve again. Right now, our curve is not flat at all. It's going straight up. So we need to flatten the curve again. In order to do that, everyone that can hear my voice, and even those who can't, need to practice the 5 core actions.
From Grace with WBIR, what was your recommendation to Knox County schools for reopening? What does that partnership look like?
That's a long-standing partnership, and we talk very regularly. Probably right now, almost daily, somebody on my staff is talking to the schools with questions and concerns and just clarifying things. Our recommendation was that they create a plan that includes the 5 core actions. I know I sound like a broken record, but that's really what they need to do as well. Just like any other, the schools are kind of a business. They're a different kind of business, but their staff and their patrons, the students, all need to observe the 5 core actions whenever possible. And if they do that, I believe that our students and the school staff can return to school safely.
From Alex with News Talk 98.7, would you make any changes to the Knox County Schools reopening plan, or do you think their plan is adequate in keeping students safe who chose to go to school?
Again, their plan is based on the 5 core actions. It'll be up to the Board of Education if they want to make changes to that plan, but it's a plan that's based on the 5 core actions, and any plan based on the 5 core actions is going to be one that keeps people safe.
From Grace with WBIR, Knox County Schools said they're looking at guidance from you all that would send them into a quote level red and go virtual. What kinds of trends would you need to see in order to advise them in that manner? And why isn't now a red situation?
So actually what the Knox County Schools in their plan said that they will be looking at several data points. And I don't know what all of them are, but there are several data points that had to do with student attendance and staff attendance and ability to get substitutes, just like they always do during flu season. They look at those data points to see where they are internally, and then they just consult with us about what the situation is in the community. So, you know, our case is going up, our case is going down, or where are you seeing any hot spots? So we have those communications. So that's just one piece of data that they look at to determine, and they'll be determining whether they're red or yellow, not us. That'll be determination by the schools, and you can ask them what trends they would want to see in order to decide red or yellow.
Scott with Compass asks if you can report the age and gender of the 2 fatalities reported yesterday, and I can give you that information. Scott, it's an 81-year-old female and an 84-year-old male. Claire with WUOT asks, have you received a report from the CDC following up on their visit last week? If yes, what are the key points, and when do you plan to release the report to the public?
So the report really was kind of a summary of the visit, who was there, and we have received it, who was there, topics that were discussed, concerns that were brought up, recommendations for actionable items for Knox County, but actually a lot of asks from Knox County hospitals and others to the CDC and to FEMA and to ASPR, which is, I can't remember what that stands for, it's an acronym, to what are some things they might be able to impact at the federal level to help us at the local level. Some of those things were around very obvious stuff like testing and other resources that the federal government might have to help us, information in other languages. One of the challenges we have is people who English is not their first language. We want to be able to communicate to them in a meaningful way, and having those resources locally can be hard for us. So asking them for some of those resources that they might have at the federal level, and we look forward to I think we've actually gotten some of that stuff back, but and so that'll be shared with the partners that were at the meetings. If you'd like a copy, you certainly can ask for it.
From Grace with WBIR, KCHD reports 28 cases for 11 to 20-year-olds and 8 new ones for 0 to 10-year-olds. Any new clusters related to kids or concerns about kids?
I know we have clusters. I don't have specifics on clusters about the age range of the clusters. We have clusters that span all ages, and so honestly, there aren't any specific clusters that I'm aware of related to children or younger people.
And any concerns about kids?
Well, certainly, we're concerned about everybody, not just about kids. We want everybody to be safe and practice the 5 core actions and do those on a daily basis. Children, adults, it doesn't matter. We haven't seen a lot of child illness from COVID, but we have seen children in other areas that have had after effects from COVID, where they maybe had really mild COVID disease, but then they have that reactive disease later where they get inflammatory processes in their system, which is really dangerous. So it's important to protect our children. And those folks who are younger, who may not get severe disease, as you heard Monday evening, unfortunately, we actually had somebody in their 20s in Knox County, or maybe not Knox County, but pass away from COVID at one of our Knoxville hospitals. And so this disease is not a respecter of age or gender. It can affect anyone, and anyone can become severely ill from this disease.
From Brian Hornback, how can the 6-foot social distancing be accomplished in the classroom?
It's a great question for the schools. Those logistics will have to be worked out by them.
From Vincent with the Sentinel, Dr. Buchanan told the board that KCHD was not able to contact trace everyone due to problems with testing, but you're still rating your contact tracing capability as green. Can you explain this discrepancy?
I think there's a misunderstanding. Of all the positive cases we know about, we are contact tracing all of them. Cases we don't know about yet, we can't contact trace them because we can't call them and talk to them.
Also from Vincent with the Sentinel, a recent study from the Lancet found that delaying contact tracing multiple days after symptoms develop produces negligible benefit with respect to preventing COVID-19 cases. This is how contact tracing after 10 days meaningful with respect to COVID-19 prevention.
I think I know what you're asking. And the Lancet is exactly right. That's why the testing delay is such a big deal to us. The sooner we know about a case, the sooner we can get them in isolation, the sooner we can get any of the people that are at risk in quarantine, protecting other people. You've heard us talk about breaking the chain of transmission. That's what contact tracing is all about, breaking the chain of transmission. And these delays in testing are causing that not to happen, unfortunately. So that's why we are really asking people to self-quarantine or isolate if you any nuanced. If you get tested, we want you to stay home unless you have to go out for something essential until you get your test results back. That's really important because we do have a testing delay, and we are working to expand the number of laboratories we can use. The testing delay is not unique to us or Knoxville or Knox County or the state of Tennessee. It is across the country. The volume of testing is so high that the labs can't keep up. And again, I'll go back to appropriate use of testing. Screening employees to come back to work and other uses for screening purposes are really not appropriate used for the test. The test is really meant for diagnosing COVID-19 in those most at risk.
From Grace with WBIR, is the Board of Health meeting weekly now? If so, why?
The Board of Health is meeting weekly now because they decided to.
Also from Grace with WBIR, the current plan for KCS involves notifying parents of positive cases. Will those be reported by you all or tracked at all?
So that's an internal plan for Knox County Schools to do what they do, which they actually do with other infectious diseases throughout the year. So that's something that's their internal plan. Those cases otherwise will be handled like all other cases. The schools will be helping us with some contact tracing for students or staff that become positive, because that just helps. They have access and they can get that information sometimes a little more quickly and easily than we can.
From Jeff with WATE, what's the likelihood of cutting the lag time in test results and how might that be accomplished? I'm asking because the NCAA's guideline for fall sports is negative test within 3 days in order to play. Clearly 10 days won't work. Could we get down to 3 days or less by football season?
We do need to get the delay between testing and results down in order to do our public health job. That's going to work. That's going to happen by labs being able to increase their capacity and also labs not being used inappropriately.
From Claire with WUOT, in what situations does KCHD use pooled testing?
We currently are not using any pooled testing.
Any other questions? Please go ahead and submit them now. All right, I see someone says they're typing, so we'll give you some time to type out your question, Grace.
It's a long one.
All right, the question from Claire with WUOT is a July 14th document from the White House Coronavirus Task Force says Knox County is a yellow zone for cases and recommends that officials use pooled testing for households and limit gatherings to 25 people. Can you explain why Knox County isn't implementing this federal guidance yet, and do you plan to?
Haven't seen that federal guidance. So, the Board of Health is providing guidance for how we're operating and the numbers of people gathering. And so that decision is being made locally by the Board of Health. I think pool testing is a tool that some places are able to use. I'm not aware that we even have the opportunity to have pool testing here. If we have a case in a household, the whole house is quarantined. So we're breaking the chain of transmission that way.
From Grace with WBIR, with the current testing capacity and delays, will KCHD be able to handle an additional 20,000 people in town from UT?
Oh, students. I was like, sorry, it took me a minute to think of who the 20,000 people are. Well, fortunately, we have a really great partnership with UT, and they'll be doing really managing that internally and doing the testing that they need to do internally. And I'm not sure how they're handling students and asking them to what they want them to do in order to come back to campus. That'd be a great question for UT.
All right, any other questions? Please go ahead and submit them now. All right, not seeing any other questions come in. So thank you all for joining us, and we hope you have a great and safe weekend. Bye-bye.